Medical milestones are happening every day at Memorial. Lake Charles Memorial Health System is transforming healthcare services, expanding vital specialty care, and bringing essential economic benefits beyond medicine. Over the next half hour, learn more about your not-for-profit, community-owned health system and the future of healthcare in Southwest Louisiana.
Welcome to Lake Charles Memorial, your regional community health system. I'm your host, Matt Felder, for this first edition of Memorial Medical Milestones. I'm standing in Memorial's new state-of-the-art intensive care unit up on the 9th floor. A little later in the show, we will take a look at this new facility. It's one of many improvements to the health system as we build a better patient experience for you. We also sit down one-on-one with our new Chief Medical Officer as he lays out his plan to increase patient safety. But first, when you think of Lake Charles Memorial, you think of doctors, nurses, and healthcare. But did you know it's one of the largest employers in Southwest Louisiana? See how Memorial is more than medicine, generating hundreds of millions of dollars in economic development.
From its humble beginnings as a 100-bed hospital, Lake Charles Memorial has transformed into a 365-bed health system. Memorial stretches across 4 campuses and boasts the most doctors and specialties in the region.
We've been able to invest roughly $166 million back into the hospital with a new ICU, a new emergency room which is under construction, and a new office building. We've totally refurbished all of the operating theaters. So invested quite a bit of money back into the hospital. Maybe more importantly though, we've been able to grow the Memorial Medical Group from around 20 physicians to over 90 physicians today, and we're still recruiting.
Unlike corporately owned hospitals, Memorial is able to keep any and all money it makes home in Lake Charles. The money is reinvested into new facilities, technology, services, and staff. Beyond the medicine and medical care Memorial provides, the health system has grown into the largest non-government employer in Lake Charles. Today, around 2,800 employees work at the Memorial Health System across a wide range of positions. That accounts for more than 8% of the jobs in Calcasieu Parish.
Many people think that hospitals only employ nurses and doctors and technicians. That's not really the case. In those 2,800 employees, probably half of them are clerical and other professions as well.
These jobs translate into more than $152 million in salaries and benefits paid to employees each year. According to the American Hospital Association, each hospital job supports 2 more jobs, and every dollar spent supports more than $2 of additional business activity. When you factor in spending by the health system, taxes paid, construction projects, money spent by employees, and economic multipliers, Lake Charles Memorial has an economic impact of more than $900 million in Southwest Louisiana.
As a regional community hospital, we're locally owned, and what that means is that every cent that we generate is put back into the organization, which then gives us the ability to invest $166 million in physical plant. But it also gives us funding for more employees, better benefits, and so on.
For a look at the complete Community and Economic Impact Report, visit lcmh.com/community report. Well, stay with us. Coming up after the break, we will show you the new buildings and expansions happening around the health system.
More doctors, more specialties. Memorial Medical Group has the best healthcare experts working together to coordinate the best possible care centered around you. Some 27 specialties and subspecialties recruited from the best medical schools and health systems nationwide. To find a board-certified, board-eligible, or fellowship-trained Memorial Medical Group specialist, call 1-800-494-5264 or visit lcmmg.com. Memorial Medical Group. Expert care starts here.
Life-threatening illness and trauma require the highest level of expert care. That's why critical care starts at Memorial. We're filling the critical care void in Southwest Louisiana by doubling the size of our ICU and emergency room, pioneering stroke and trauma care, expanding heart and cancer treatment, and building our new mental health hospital. The future of critical care medicine is here. Memorial, building a better patient experience for you.
Since 2006, more than $166 million has been spent to upgrade services and facilities to bring you a better patient experience. One of those major projects is here on the 9th floor, which is now home to our state-of-the-art intensive care unit.
Critical care starts here in a new state-of-the-art medical intensive care unit.
I think the ICU is fabulous. It's great, it's beautiful, it's everything that I've always dreamed about.
This $6 million project has 16 rooms, each around 250 square feet, about double the size of what medical staff are used to, giving patients and family members more room for comfort and medical staff more room to work.
The big room in an ICU makes all the difference in the world to perform duties at all levels of care, such as physical therapy, dialysis, teaching, nurse duties, bronchoscopies, any duties whatsoever. You need the space and you need to be able to mobilize.
The design of the unit is laid out to where nurses can keep an eye on patients at all times. Glass doors and workstations allow for a direct line of sight. The third floor ICU will be renovated in the same fashion in years to come and be used as a surgical ICU. The new unit gives the hospital 32 beds for critical patients, with every inch of the design made with input from decades of experience.
Knowing what the patient's needs are the reasons that we became involved from the very beginning. And that has been a fabulous journey with lots of design planning and architectural design changes according to the needs of the staff as well as the family.
The front door to any hospital is the emergency department, and Memorial's ER has been flooded with visitors lately. The increase in patients called for an expansion that doubled the ER size in hopes of getting patients treated faster while cutting down on wait times.
Hundreds of patients come through Memorial's emergency room each week. It's not uncommon for medical staff here to treat over 200 patients a day.
Our volume has definitely doubled, not only in numbers, but also in the acuity of their illness. But we do have quite a few that are very ill also.
This patient increase has led to a massive construction project to the tune of $14.5 million. The expansion doubles the size of the emergency department with more beds, a larger waiting room, and specialized treatment areas depending upon the seriousness of the injury or illness. There will be a test results waiting room and a fast track for patients with non-life-threatening conditions.
The new emergency department will be divided into several sections. We'll have a dedicated trauma rooms that will be able to accommodate 4 to 8 patients. We'll have a dedicated psychiatric area, a dedicated fast track area, and extended monitoring systems throughout the entire department.
The new ER is designed to help get patients diagnosed, treated, and through the care process to drastically reduce time spent in the waiting room. Getting patients treated faster will also mean ambulances and EMTs won't get tied up in the ER. They can get patients processed and be out the door to their next call.
Yes, as we expand our coverage and specialists available to us, whether it's in person or via telemedicine services, we're actually able to keep those patients here in Lake Charles area. It's more convenient for them and their family members throughout their illness.
Memorial has board-certified emergency medicine doctors that are available on a 24-hour basis. This high level of care is something the hospital continues to build on.
We're actually in the process of developing our trauma program to a level 3 and at some point in the future to a level 2 program. We're in the process of recruiting trauma surgeons for our new emergency department and expansion of the hospital.
With the addition of more doctors and more specialties to the Memorial Medical Group, office space has been hard to come by. That led to the decision to build a 2-story office building on Nelson Road that will house up to 15 doctors and an urgent care.
Joining Memorial Hospital for Women in South Lake Charles, a 20-foot sign signals the entrance to a new medical office building off of Nelson Road.
We decided to put a medical office building on Nelson Road because the hospital's main campus was almost full. It'll be primarily for primary care and specialists, but we'll also have an urgent care center there.
The move is part of a regional plan to bring medical care closer to patients with the growth of more doctors and specialties to the Memorial Medical Group. This 2-story structure will be able to accommodate patients for up to 15 specialists, along with an urgent care center for those injuries and illnesses that need immediate attention but do not require a trip to the ER.
Well, the building is about 35,000 square feet and obviously 2 floors. First floor will have the urgent care center and doctor's offices. The second floor will be all doctors' offices. We anticipate about 15 physicians will be able to use that facility.
You have seen the investment Memorial is making in critical care, but even after you are treated for the most severe injuries and illnesses, physical therapy becomes the next most important step. See how our new Independence Walk will change the game in rehabilitation.
Patients undergoing intense physical rehabilitation at Memorial can now take a drive, that is, without ever leaving the hospital. This new state-of-the-art simulator is a new tool on the road to recovery.
The good thing is we have 70 different driving scenarios, and we'll be able to test things like reaction time. How quickly can we brake? Is the patient able to scan to his left and his right? Is he truly, or is she truly able to function behind the wheel in a manner that makes the doctor feel that he's comfortable with letting them know that they can return? But it also gives us a tool for providing therapy to get them used to reacting behind the wheel.
This $65,000 simulator is the only one available in Southwest Louisiana and one of the few in the entire state. It's all part of a complete expansion of real-world rehabilitation that includes the new Independence Walk. This area of the hospital will include functional stations that patients encounter in everyday life, such as a grocery store, an automobile, and various types of walking surfaces.
Our ultimate goal is the same as the physician and the family and the patient, the quickest return to home that we can achieve. And the high expectation nowadays is to get people home as soon as 2 weeks or a little bit more.
The rehab expansion is made possible through gifts from the foundation at Lake Charles Memorial.
The mission of the hospital is to provide compassionate care to people within a 5-parish region. The mission of the foundation is to support that care by providing financial resources for projects and for special programs.
Because of their commitment to the community and bringing the newest technologies to Memorial, employees themselves stepped in with donations to fund the Independence Walk, along with a generous gift from Joe Miller Sr., a former board member and part of the architectural team that designed the original hospital.
We have a very supportive philanthropic community, and our board understands that our mission is to assist in the programs and projects that we have at the hospital. We also have a very supportive employee base as well.
Well, lots of things happening these days, and we are not through yet. Coming up, we show you a project that will help treat the mind. Stay tuned.
It's not just magazines. It's comforting patients. It's more than a blanket. It's easing anxiety. It's not about gifts. It's uplifting the spirit. It's more than popcorn. It's building friendships. It's beyond just the music. It's healing the soul. It's not just a hello. It's humanizing a patient's experience. Lake Charles Memorial Health System. It's not just volunteering.
More doctors, more specialties. Memorial Medical Group has the best healthcare experts working together to coordinate the best possible care centered around you. Some 27 specialties and subspecialties recruited from the best medical schools and health systems nationwide. To find a board-certified, board-eligible, or fellowship-trained Memorial Medical Group specialist, call 1-800-494-5264 or visit lcmmg.com. Memorial Medical Group. Expert care starts here.
We're the hospital that you built. You are our stakeholders. As the regional healthcare leader, you've invested your trust in us because you understand the role we play beyond medicine. And in return, we're transforming healthcare services, expanding vital specialty care, and bringing essential economic benefits to our community. The future of healthcare is here. Memorial, building a better patient experience for you.
Before the break, we showed you tens of millions of dollars in upgrades that have taken place. The work is far from over as we move to South Lake Charles with a new campus that will help address a much needed area of healthcare, behavioral health.
A lack of mental health services in Southwest Louisiana and statewide are at critical heights, and Memorial is stepping up to fill a much-needed void.
We have to transfer a lot of patients out to other facilities across Louisiana, trying to find beds for them to go in the inpatient setting and receive treatment. Many times our patients may wait a few days before they can get into an inpatient bed. We definitely need a larger facility.
Memorial's new psychiatric hospital will be built in South Lake Charles, across from the Memorial for Women campus. The team of architects and medical staff took a year designing the new hospital by looking at some of the best facilities in the nation.
This one was actually designed from the ground up, specifically with patient needs in mind and current state-of-the-art psychiatric care. And so we can do things with this facility that we would not be able to do with a facility that we were renovating, for example.
The first phase is set to open in 2017 and will have 42 beds for adult and adolescent patients. The second phase includes geriatric services and a substance abuse wing. When both phases are complete, a total of 96 beds will be available through 4 separate units, with each unit consisting of its own outdoor space. Patients will be able to receive a free assessment on what level of treatment they may need instead of going to the emergency room.
Mental illness doesn't really discriminate. It is, no one person's immune to it. So in times where maybe a traumatic event may occur, a loss of a loved one, anyone can be susceptible to a loss of their coping skills, and a severe depression may set in, which that person may no longer want to live. And we want to know in those times, if that individual is not familiar with mental health resources, they'll know that this facility's here, this is what we have to offer, come in and let us help.
When it comes to healthcare, quality is what patients expect. Our GI Center has recently been recognized for its excellence and experts, and also features some new state-of-the-art equipment to improve disease detection and treatment.
Inside Memorial's GI Center, quality is at an all-time high.
There's a strict, rigorous criteria for obtaining certain quality measures that we monitor for, usually when we perform endoscopy. And we have excelled at some of those quality measures to obtain that achievement.
The American Society of Gastrointestinal Endoscopy has recognized the center for its excellence, one of only 7 in the entire state to achieve the distinction. The recognition comes at a time when the GI Center has upgraded its diagnostic technology with the latest state-of-the-art equipment.
It's digital, high-definition photography, so that the polyps, which are extremely difficult to detect most of the time, are much easier to detect because of the quality of the picture. The technology also allows us to shoot video if necessary for referral to a surgeon for any of the disease processes that go along with gastroenterology.
The new scope allows doctors to peer inside the human body to diagnose and detect gastrointestinal diseases earlier when treatment is more successful, as with colon cancer.
Well, we have the latest equipment that's available, and we recently upgraded all our equipment here at Lake Charles Memorial Hospital, and which tremendously improves our capability to detect any GI lesions or diseases.
Plus the ability to respond better to emergencies.
Our staff have the ability to respond either in the ER or bring the patients here to our gastroenterology lab, or go to the units where we have patients that can have emergency bleeds. And we have the technology and the ability to treat those patients emergently and get them under control.
Coming up after the break, we sit down with our Chief Medical Officer for some insight on how Memorial goes about improving patient safety.
More doctors, more specialties. Memorial Medical Group has the best healthcare experts working together to coordinate the best possible care centered around you. Some 27 specialties and subspecialties recruited from the best medical schools and health systems nationwide. To find a board-certified, board-eligible, or fellowship-trained Memorial Medical Group specialist, call 1-800-494-5264 or visit lcmmg.com. Memorial Medical Group. Expert care starts here.
Life-threatening illness and trauma require the highest level of expert care. That's why critical care starts at Memorial. We're filling the critical care void in Southwest Louisiana by doubling the size of our ICU and emergency room, pioneering stroke and trauma care, expanding heart and cancer treatment, and building our new mental health hospital. The future of critical care medicine is here. Memorial, building a better patient experience for you.
Well, welcome back. Well, along with critical care, patient safety is a top priority for Lake Charles Memorial. Today I'm joined by our Chief Medical Officer, Dr. Manley Jordan. And Dr. Jordan, thanks for joining us today.
Thank you. I appreciate you asking me to be part of the program.
You're about half a year into your new position as Chief Medical Officer. How's it been so far?
You know, I could use a lot of adjectives to describe it. It's been obviously very interesting, challenging, but rewarding would probably come to the top of the list. But I have to tell my patients who are watching, I want to thank them for allowing me to be part of their lives, and I still miss them. But I've enjoyed this transition, and it has been very, very interesting, and it's been fun.
Well, one of the transitions you've been focusing on is patient safety and increasing that in Lake Charles Memorial. Tell us sort of your plans.
You know, I think we're trying to align our goals with patients and their families' expectations. And quite simply, patients should be able to expect three things. Number one, to do no harm. They don't want to be harmed when they come to the hospital. Number two, they want to be healed. And number three, they want to be treated nicely. So those are our goals, and those are very reasonable expectations by patients and their families. But putting them into practice is quite difficult given the complexity of the hospital system.
Well, Dr. Jordan, you talked about the three expectations patients have when it comes to their safety in the hospital. Now, how do you implement a plan to help protect that patient?
Obviously, one of our biggest concerns is health-associated infections. We try to standardize removing devices such as Foley catheters, central lines, which are catheters and vessels, to try to reduce infections. We also are implementing measures to try to decrease delirium, which can lead to falls. So it's a concentrated effort. You have to make it a point of emphasis, but we are trying to standardize that more and more to where it doesn't get missed.
Dr. Jordan, you talked about hospital-acquired infections, and the proper use of antibiotics comes into play there. What is your plan when it comes to that?
Certainly, appropriate antibiotic utilization is receiving more and more focus. Recently, you've heard about the superbug, where it's resistant to all known antibiotics. So appropriate utilization and stewardship of antibiotics is very important. Antibiotics are appropriately utilized when you use the right amount for the right duration. Too little can harm patients, but also too long or too much medication can be harmful. So we're focusing on appropriate utilization and stewardship of antibiotics.
Well, obviously, one of the big aspects of when people come to our hospital is to treat them and send them back home. And you have new protocols to help do that and heal the patient.
Right. With more and more research being done, we have identified best practices or evidence-based medicine, and we're trying to apply that in a more standardized, uniform way. Examples of applying the science of best practice would be in certain conditions like heart attack. We know that certain medications, when given at certain time periods, you improve outcomes, particularly survivability of a heart attack. Congestive heart failure is another disease process that we've identified certain types of medications that improve outcomes. So we're trying to make this a standardized part of treatment and not relying so much on just hoping people order the right things, but trying to apply the evidence base or the science to the evidence-based practice of medicine.
Well, obviously, the third aspect is when people come, treating them and healing them, but also they expect to be treated with respect. And how do you go about ensuring our nurses and our doctors do that?
I think the last expectations that certainly we'd like to meet is patients being treated nicely. And any quality program, particularly if you talk about a service industry, and healthcare is a service industry, you can divide quality into two components: the content and the delivery of that service. In healthcare, the delivery of the service is the patient experience or their satisfaction. It's so important that CMS has developed a survey that most people are familiar with. It's called HCAHPS, which is an acronym. But HCAHPS is a survey administered to patients after discharge and inquiring about their expectations and if they were met or not. These questions center around communication with doctors and nurses. It centers around the discharge process and how well the patient and the family understands and is comfortable with the discharge process. It has to do with the environment and how clean the environment is and how quiet. So it is very much an important part of what we do, because certainly being respectful to patients, without that healthcare has fallen short.
Well, Dr. Jordan, as you well know, that building a better patient experience is kind of our motto around here, and that goes from the building to the facility to the care they received. And how do you go about building that better patient experience?
You know, engagement is a buzzword these days. Engagement means getting everybody involved, and clearly it's going to take a team effort. It's going to be the doctors with the nurses, with the technicians, with dietary, and also very important is including the patient and the patient family as part of that team. So I think the answer is going to be a collaboration, and with that we feel like we're going to continue to be successful.
Well, appreciate your time today, Dr. Jordan. Thanks for joining us on the show.
I thoroughly enjoyed it. Thank you so much.
All right, well, stay with us. Coming up after the break, you will hear from one of our patients on their experiences here at Lake Charles Memorial.
It's not just magazines. It's comforting patients. It's more than a blanket. It's easing anxiety. It's not about gifts. It's uplifting the spirit. It's more than popcorn. It's building friendships. It's beyond just the music. It's healing the soul. It's not just a hello. It's humanizing a patient's experience. Lake Charles Memorial Health System. It's not just volunteering.
More doctors, more specialties. Memorial Medical Group has the best healthcare experts working together to coordinate the best possible care centered around you. Some 27 specialties and subspecialties recruited from the best medical schools and health systems nationwide. To find a board-certified, board-eligible, or fellowship-trained Memorial Medical Group specialist, call 1-800-494-5264 or visit lcmmg.com. Memorial Medical Group. Expert care starts here.
We're the hospital that you built. You are our stakeholders. As the regional healthcare leader, you've invested your trust in us because you understand the role we play beyond medicine. And in return, we're transforming healthcare services, expanding vital specialty care, and bringing essential economic benefits to our community. The future of healthcare is here. Memorial, building a better patient experience for you.
Welcome back. Throughout our program, we have shown you the investment Memorial is making in critical care. As we leave you, we would like you to hear from one of our own patients on their experience in their own words.
I'm a retired firefighter. I'm used to stressful situations. But after minor surgery, my lungs went into shock and shut down. I was in intensive care for several months, but I made through it. It's really a testimony to the skilled care I received. I can honestly say I wouldn't be here today if it weren't for prayers and the pulmonary doctors at Memorial. Great job.
That'll do it for this edition of Memorial Medical Milestones. For more information on the services available through our health system, go to lcmh.com. Until the next time, we will continue to work to bring you a better patient experience.
Memorial Medical Milestones was brought to you by Lake Charles Memorial Health System, your regional community health system. For more information on the topics in the show, go to lcmh.com/medicalmilestones.